Welcome back, everybody. Taking a break from cooking to talk about something very, very important. May is Skin Cancer Awareness Month, and today is Melanoma Monday. And Dr. Lisa Campbell is here from Dermatology Associates to discuss the prevalence of melanoma and the dangers associated with it. Good morning, doctor. Thanks for being here.
Thank you for having me.
You bet. But first of all, I think we've all heard of melanoma, but what is it?
Well, melanoma is best characterized as a change in color of the skin. It's a true cancer, and while it just seems like just a skin cancer, it can become an internal cancer and cause death.
So it's scary, and it's something that should not be ignored, for sure.
For sure, yes.
What are some of the causes?
Some of the causes of melanoma are most likely ultraviolet radiation. That's the single most common cause of skin cancer in general, and while other things can cause it, it is the most preventable type of exposure.
So just going out in the sun you're talking about?
Just going out in the sun, as well as indoor tanning, can cause it as well.
So that indoor tanning is a big, big no-no.
Probably best to avoid for most people.
Who's most at risk for developing melanoma-based cancers?
Anybody can develop melanoma at any time in their life. The scary thing with melanoma is it can occur in any person, regardless of age, race, etc. It is becoming really a problem in young people. The incidence has been raising over the last 30 years, and about 1 in 50 Americans will develop melanoma in their lifetime.
But people who are, working outside a lot, or going to a tanning bed, or especially, younger people who are going to tanning beds, you really want to let them know that this is dangerous and you need to take precautions.
Absolutely. The more exposure to ultraviolet radiation that you have, either in the form of sunlight or in the form of the indoor tanning, which produces the ultraviolet A rays, can cause melanoma, as well as maybe some genetic and immunosuppressive factors that we don't have control over. However, that sunlight or indoor tanning is the most preventable.
So what does it look like? So let's say, you might be worried about a little spot that you have. How would you might know that you need to get it checked out? Sure.
When we counsel our patients on what to look for in their moles, we're looking for the A, B, C, D, E's of melanoma. And so the A stands for asymmetry, or whether that lesion on your skin looks the same side to side. The B is for border, and that recognizes that most skin lesions should have a nice smooth border around the outside, shouldn't have jagged edges, shouldn't have kind of fingers sticking off to either side. C is changes in color, so that change in color, but also different colors within a skin lesion. So most are brown and fairly evenly brown, maybe a little bit of a light spot, but they shouldn't have gray, black, blue, red colors in the mole as well as those. Diameter, about a pencil eraser in size. Larger than that, you might be more concerned. But melanoma can be, it starts as a small lesion, so we don't want to make that the most important thing. And then the key factor for us as dermatologists is evolving or changing, that lesion that has changed over time.
Okay, so keep an eye on it for
Yes.
sure. But if you have any concerns, of course, it's always best to be safe rather than sorry.
Absolutely, yep.
Anything we can do to prevent melanoma?
I think that the most important thing is to watch how much ultraviolet light you're getting, and we can wear sunscreens, and an SPF of 30 would be recommended by all dermatologists.
Every day, not just when you're going to the beach,
Yes.
So now there's so many different lotions out there that, just when you're putting lotion on and you're, in the morning, or maybe your cosmetic foundation has it built in. That's a great thing.
That's a great thing. It makes it much easier for most people. If you're going to be outside for extended periods of time, however, you will need to reapply. The sunscreens that we have available to us today generally last no longer than about 80 minutes, particularly if you're in the water. So you need to reapply that sunscreen if you're out all day gardening, or if you're going to a baseball tournament all day, you'll need to reapply that sunscreen.
I take a baseball cap visor with me, hat,
Yep.
Always, all the time, just to have, so
Yep.
yeah.
So you talk about protective clothing, the hats, even simply as putting a shirt on, long sleeve shirt, pants, if you're going to be exposed. You can also utilize just standing in the shade rather than standing out in the sun. You'll see a lot of playgrounds these days have the shade structures, actually. We're trying to do better by our kids as well.
That's where I like to hang out with a good book. So in the shade. Doctor, thanks so much. How can people find out more if they're concerned about something? And you always encourage people, if you've got a concern, don't let it go.
Absolutely don't let it go. Prevention is the key, and early detection of a melanoma. The cure rates for an early detected melanoma are in the 98th percentile. percentile
Wow.
or 98% range, where if you let it go, it can cause death. So get those moles checked early if you're concerned or if they're changing, and see a dermatologist. We have lots of dermatologists in the area. About once a year, if you consider yourself at risk, would be advised, especially if you've had skin cancer in the past, as that's a warning sign.
Thank you so much, Doctor. Dermatology Associates, locations all over Northeast Wisconsin.
That's true.
So
Yes.
appreciate it.
Thank you.
Coming up, a steak and Brussels sprout salad recipe. So don't go anywhere. We'll be back.